Happy International Pharmacy Technician Day. My name is Alison Hemsworth and I am a pharmacy technician. If you have not heard of Pharmacy Technicians International before, I am here to introduce you to the organisation. Pharmacy Technicians International, as it stands today, grew out of personal need to be able to implement international best practice. Relevant networking led to the formation of a steering group of like-minded pharmacy technicians from across the world acting in a personal capacity. Now, we are a global community of practice for pharmacy technicians and have nearly 2,400 members from across over 60 countries. Our stated purpose is to promote global awareness of the profession and its role in healthcare. We share, innovate, and collaborate on research and other endeavours. We create opportunities to raise awareness of the existing and developing role of pharmacy technicians across the world. And our long-term goal is to see the development of international best practice. By sharing knowledge and information, we hope to inspire and empower other pharmacy technicians to create and lead change relevant to their own communities. We thought International Pharmacy Technician Day would be a great time to share some videos about recent developments for the pharmacy technician profession across various countries. This is only a snapshot, but believe me, it's an exciting time to be a pharmacy technician. Videos will be released throughout the day, so please do stay tuned. If you find the content of the videos interesting and you are a pharmacy technician or someone training to be one, please do come and join our community. Equally, if you lead another organisation that supports the pharmacy technician profession and would like to collaborate with us, the steering group would love to hear from you. You can find our contact details at the end of every video. Send us a message and we'll let you know how you can get involved.
Hello, happy Pharmacy Technician Day. My name is Diane and I am a member of the Pharmacy Technicians International Steering Group. I'm a pharmacy technician in Canada. Canada is a large country consisting of 10 provinces and 3 territories. There are more than 9,500 pharmacy technicians in Canada. There is a national certification body for the pharmacy technician profession, although not all jurisdictions participate in certification of pharmacy technicians. Each province and territory has its own college, which regulates the profession of pharmacy in their jurisdiction. Canada has a National Association for Pharmacy Technicians and Assistants. CAPT, or Canadian Association of Pharmacy Technicians, was established in 1983. CAPT represents pharmacy technicians and assistants on various pharmacy-related organizations in Canada. Each year, CAPT offers a national professional development conference in a different city throughout the country. We also have some provincial organizations representing pharmacy technicians. In Alberta, the province where I live, the Pharmacy Technician Society of Alberta, or PTSA, provides leadership to the pharmacy technician profession by enhancing professionalism through education and collaboration with members and affiliates. PTSA offers an annual conference for pharmacy technicians from all areas of pharmacy practice: hospital, community, long-term care, distribution facilities, and education. The conference provides an opportunity to network with other pharmacy technicians, as well as gain new knowledge on a variety of subjects. Our sister organization, PTSBC, is the leader for pharmacy technicians and assistants in the province of British Columbia and plays an integral part in optimizing pharmacy services. If you're watching this, you're probably on Facebook. Pharmacy Technicians International has a Facebook page that is centered around professional development for pharmacy technicians. Join the chat, and thanks for listening.
Happy World Pharmacy Technician Day. My name is Tara Clayson Fisher and I'm a pharmacy technician in Hobart, Tasmania, Australia. Australia is home to more than 30,000 community pharmacy technicians and 7,000 hospital pharmacy technicians, and this year has seen our professional organisations become more welcoming of pharmacy techs at every level of governance and leadership. Working together to support the development of better education programs and frameworks that support expanded scope roles such as accuracy checking and clinical support activities like medication history taking. Expanding our scope of practice in a way that empowers all pharmacy technicians and pharmacists to work at the top of their scope. It's a pleasure to be a part of an international group of pharmacy technicians where we can learn from each other's experiences, share stories, and work together to ensure that pharmacy technicians are valued across all areas of health. Happy World Pharmacy Technician Day.
Hi, I'm Paula and I'm a UK trained pharmacy technician now living and working in New Zealand. As the population is so small, just under 5 million, it makes it much easier to collaborate with a great network of people in pharmacy and agree to get things done. The pharmacy qualification is gained either by distance learning whilst working in a pharmacy or by attending college and having regular work placements throughout the course. The minimum qualification is a Level 4 certificate whereby pharmacy technicians can dispense, or they can choose to go and study Level 5 certificate, which also allows them to compound medicines and provide advice on medication. In 2015, a new qualification was developed, a Level 6 certificate, which has since become a diploma. Pharmacy technicians can also undergo a training programme with the Pharmaceutical Society of New Zealand in order to become a pharmacy accuracy checking technician, which means they can perform final accuracy checks on dispensed items that have been clinically approved by a registered pharmacist. Pharmacy technicians are not registered in New Zealand, which makes it very difficult to obtain data about the profession, but a survey that was undertaken in 2022 gives a good indication. Of the 464 pharmacy technicians who took part in the survey, the majority were female. Most were New Zealand European, called Pakeha, followed by Māori, Indian, British, and then Chinese. 80% of the responders worked in community pharmacy. There are pharmacy technicians working in education, teaching either pharmacists or pharmacy technicians, and in industry. And pharmacy technicians are now moving into leadership roles, including dispensary management, which is awesome to see. And New Zealand also has 3 pharmacy technicians who are part owners in retail pharmacies, which again is a great step forward.
Hi, my name's Yvonne. I'm an Irish pharmacy technician with many years hospital experience. I have moved over to a national project role called HIMSS. HIMSS Medicines Management System is a pharmacy software system that will provide a platform for electronic prescribing and electronic medicines administration. HIMSS will interface with a hospital PAS system, ADC cabinets, dispensing robots and finance systems. This is exciting times ahead for Irish hospital pharmacy and for Irish hospitals as these new technologies support the safe and cost-effective use of medicines. I hope this new system will bring across efficiencies in the pharmacy department and also help expand pharmacy technician roles into areas such as informatics and helping roll out further technologies across the hospitals. As part of my role, I will be deploying this system into hospitals, helping with the configuration and helping each and every one of you through this change management process. This is exciting times for pharmacy technicians, and I would like to wish you all a happy Technicians' Day.
My name is Jo Sutton. I'm the lead for pharmacy technician training in the Northern Ireland Centre for Pharmacy Learning and Development, or NICPLD. I have been asked by Pharmacy Technicians International to tell you what's been happening in Northern Ireland. In the last 2 years, things in Northern Ireland have moved forward significantly with pharmacy technicians. In 2022, a regional consultation returned in favour of the introduction of statutory regulation of the pharmacy technician workforce in Northern Ireland. This would bring the Northern Ireland pharmacy technician workforce in line with the Great Britain. For this massive undertaking, the Department of Health in Northern Ireland has recruited an oversight board and has 3 ongoing project work streams to endeavour to make this into a reality. Pharmacy technicians are involved at all levels and are an integral part of the process. This ongoing piece of work will be a huge step forward for pharmacy technicians in Northern Ireland. If you're interested in finding out what is happening with the pharmacy technician profession globally, come and join the growing number of people who are involved with Pharmacy Technicians International.
Hello, my name is Sam Quay. I am the English representative for Pharmacy Technicians International. I'm going to give you a brief overview of pharmacy technician practice in England. We are able to dispense and supply medicines from a dispensary or pharmacy, and we have the skills and knowledge to support patient safety and person-centred care. Increasingly, we are taking on more clinical tasks where we interact with patients directly, such as blood pressure measurements and vaccinations. Many of these types of activities are related to government commissioned services with the aim to increase safe access to medicines. The law has changed recently to enable pharmacy technicians to expand our practice further. We are now able to supply take-home naloxone to people without the need for a prescription, a change intended to reduce opioid-related deaths. We can also supply and administer medicines autonomously via a process known as patient group directions. The law around patient group directions sets out the governance structure required to operate safely, and the patient group directions are the legal framework that allows specific medicines to be given by registered healthcare professionals to a group of patients without a prescription. It also stipulates the training requirements. So there are many and varied roles for pharmacy technicians in England, and we take inspiration from the international pharmacy technician community to continue to advance our practice.
Bore da, hello, my name is Poonam Karai and I am the pharmacy technician working for Community Pharmacy Wales, an organisation that is responsible for liaising with Welsh Government on NHS matters on behalf of community pharmacy contractors. Frameworks in Wales enables pharmacies to provide an extended range of clinical services available consistently across the country. Primary care pharmacy technicians are undertaking the technical aspects of medicines management. Pharmacy technicians in community pharmacy are carrying out a number of services, including the Discharge Medicines Review Service, the Inhaler Review Service, and Community Pharmacy Care Home Support Service. Similar to England, Wales will be utilising the PGD mechanism in pharmacy. Examples in community pharmacy being pharmacy technicians carrying out the seasonal flu vaccination via PGD from October this year. As of February 2025, pharmacy technicians will be able to provide the contraceptive service, including provision of emergency contraception service via PGD. The health boards in Wales will go on to cascade further guidance to other sectors. Health Education and Improvement in Wales also supports pharmacy technicians by offering a fully funded 2-year pre-registration pharmacy technician course through funding from Welsh Government. Here in Wales, community pharmacy contractors are also supported with funding that has been made available from the Community Pharmacy Contractual Framework to enable community pharmacies to review their support staff structure, and this is called the Workforce Enabler Payment. The Workforce Enabler Payment provides funding to contractors to engage them in training and retention of their pharmacy technicians within the sector. In Wales, as a profession, pharmacy technicians are working hard to maximise the contribution they make within their multi-professional teams through more effective use of their unique skills and expertise with the services they are providing and the standards they are upholding. Thank you.
Good day, Pharmacy Technicians International. My name is Funani Olshani. I'm a pharmacy technician based in South Africa. Just to give a bit of a background of what's going on currently in the pharmacy technicians in South Africa. So currently, our pharmacy technician was introduced in 2015 by the South African Pharmacy Council as the growth or maybe a need for a delivery of healthcare in South Africa has grown rapidly from the previous years that the pharmacy sector was. So our scope of practice was actually a bit delayed, but then currently in the year of 2024, since the national health insurance was actually being signed, the bill is being signed. So our scope of practice as well, it was signed in this current year. So our pharmacy technicians started in 2015 here in South Africa. South African Pharmacy Council, they actually formalized it, and then now it actually has a scope of practice with the South African Pharmacy Council. The first university to offer pharmacy technician is Nelson Mandela University, where I also done my program. It's normally a 2-year diploma, where we learn like new ways or maybe cutting edge technologies or maybe principles, as well as ways of ensuring that pharmacy evolves into the right direction. The likes of your sterile manufacturing, aseptic techniques, and to be able to be sort of a hand where sometimes pharmacists in rural areas where they cannot be able to offer their services there in primary healthcare clinics, pharmacy technicians actually, they were developed so that at the end of the day, they can be able to assist and work hand in hand with the pharmacist, under the pharmacist, so that at the end of the day, the best outcome or maybe best health outcome is being achieved throughout like our country, which is South Africa. So thank you very much. I'm one of the pharmacist technicians, South Africa pharmacist technicians in the world. Thank you very much.
Hello, my name is Zachary Green. I am a certified pharmacy technician in the United States. I currently live in South Florida, just outside of Miami. I work at PTCB, which is the Pharmacy Technician Certification Board. I serve as the Director of Professional Affairs and also the Director of PTEC, the Pharmacy Technician Educators Council. PTCB develops the national certification exam for pharmacy technicians, and we have the CPHT credential as well as assessment-based certificate programs where CPHTs can earn their advanced certification. I also serve as the director of PTEC, Pharmacy Technician Educators Council, and that is a membership association of pharmacy technician educators and trainers. What's unique about the United States is there are no two states and territories that are alike when it comes to regulating pharmacy technician practice or how pharmacy technicians are trained to enter the workforce. So that is one definite unique thing about the United States. It's very challenging, quite an opportunity to keep up with all the regulations across all 50 states in the U.S. territories regarding pharmacy technician certification, pharmacy technician practice, as well as pharmacy technician training and education. One exciting thing, though, that I've seen in my tenure here at PTCB, I've been here 11 years, and when I started, I think there were 6 or 7 pharmacy technicians serving on boards of pharmacy. And in the United States, boards of pharmacy are what regulate pharmacy practice in each of their states or territories or districts. Now, I believe we're at 17 or 19 seats available for pharmacy technicians on boards of pharmacy. And it's really important that pharmacy technicians have that voice at the regulation level because boards of pharmacy regulate the practice in the United States, and it's really important to have pharmacy technicians have a voice in that regulatory process, especially as roles continue to expand, looking at pharmacy technicians administering immunizations, doing point of care testing, and everything like that. So it's great to see that forward momentum for the pharmacy practice in general and the inclusion of pharmacy technicians.